And Brian, just for an editor's note, the next commercial break is going to be at 7:40. Since the first one went a little long, okay? 7:40 and 7:50, okay? All right, excellent. All right, folks, first of all, the support we're getting is amazing. We picked up 3 new advertisers this week. Let's give it up for Seacoast Realty Inc. Seacoast Realty Inc. Ben's General Contracting. And Wood Design Deluxe Corp. And they're all right here in Island Park. Well, actually, Ben's is in Freeport. And Anna with Seacoast Realties in Island Park, as is Wood Design Deluxe Corp.com. Tom Ferraro. We're all saddened by the death of Robin Williams. Talk about depression and some of the things, especially severe depression that afflicted Robin Williams, that to look for in depression.
Well, depression is a relatively common illness. Maybe 10% of people in this country will have some major depression one time in their life. Major depression is very serious. It's very obvious when the person has it. Loss of appetite, anhedonia, no more fun, they can't sleep well, they're agitated, hopeless. They begin to talk about suicide, feelings they want to hurt themselves. So this is an obvious and major problem. And obviously it's a life-threatening illness.
Absolutely. Talk about what Maggie was talking about, is that people who are dealing with these houses, the postmortem depression that you touched upon.
Depression is always about loss, one kind or another. This is traumatic loss that they've had here. And when it doesn't go away, when it can't be resolved, there's a sense of helplessness, a sense of anxiety, and that can precipitate a kind of a chronic, upsetting depression and unhappiness.
Absolutely. Tom, talk about treating depression. Antidepressants. What's the treatment you feel is the best for dealing with someone in a deep depression?
If someone in your family is suffering with depression, they start, a child even, if they start talking about, I want to die, I want to hurt myself, take it very seriously. What do? You take them to the family doctor first. They may be referred to a psychiatrist. They may be given antidepressants, and they will certainly be given psychotherapy. If it's a serious depression, where they're really actively suicidal, you'll see the patient more than once a week, 2-3 times a week. If it's very serious, if there's a plot, if there's a plan to kill themselves, then they're hospitalized for maybe a month or so.
Lastly, Dr. Tom, you talked about something before the show which is fascinating, that Robin Williams, being a brilliant comic, that there's a link between comics and depression, and it's been known through history. Talk about the fascinating link of why brilliant comics like Robin Williams are prone to depression.
Well, anyone who's seen Robin Williams perform, they immediately know what manic means. He's a hypomanic kind of individual, very hyped up and excited and talking very quickly, very fast thinking. What mania is, or what a manic kind of personality is a defense against an underlying deep-rooted depression. And so if they're very manic, they're also hiding or running away from a deep depression. And when the mania gives way, when the drugs no longer work, occasionally they fall into the depression, and sometimes it can end their life.
Absolutely. Let's get up for Dr. Tom Ferraro. And we'll have Dr. Tom on down the road, but especially in this week, it was great having Tom on. I want to bring up